So in this video we'll be talking about polycystic ovarian syndrome. So polycystic ovarian syndrome is becoming a very common condition nowadays because of changes in our lifestyle and increase in stress. Although it is a multi-system endocrinopathy, but there is role of one major hormone that is the culprit for causing polycystic ovarian syndrome in 50 to 70% of the cases. In the rest, it could be either due to mutation in your gene, especially CYP21 gene, or it could be due to your adrenal problems. But in 50 to 70% of the cases, the problem is high insulin resistance. This is the primary culprit in majority of the cases. So what happens when there is high insulin in your blood? It causes increase in luteinizing hormone, and luteinizing hormone can cause thecal hyperplasia and leading to increase in androgen, and it can also cause infertility by improper oocyte maturation. So insulin can cause infertility as well as increase in androgens. So the primary treatment should be aimed at reducing your fat, because fat interferes with insulin signaling pathway in your liver and can lead to insulin resistance, because fat contains certain cytokines, fat contains leptins, so those interfere with insulin signal pathway in your liver and can cause insulin resistance. So the goal is to lose weight. Losing weight is extremely important. This is the primary aim of in treating polycystic ovarian syndrome. Also, insulin resistance is diagnosed when the ratio of fasting blood glucose to the ratio of fasting insulin is less than 4.5. Then you say it is insulin resistance. So in majority of the cases, the patient is suffering from insulin resistance and the fasting insulin is elevated. It is more than 10. So the goal of treatment is to lose weight and to improve insulin sensitivity. So how do you improve insulin sensitivity? Once you lose weight, once you are off your excess fat, that will automatically improve insulin sensitivity. Then there are a role of certain supplements. So usually your gynecologist will prescribe you metformin, but what happens with metformin, that it can cause increase in homocysteine level, and increase in homocysteine is a risk factor for cardiovascular diseases. So there are better options, and one of the best substitutes for metformin is N-acetylcysteine. How much you should take? 1.2 gram per day. Then this you should combine with other minerals, and here you should combine with vitamin D, chromium. This is very important. Chromium will also improve insulin sensitivity. Inositol and folic acid, all these will improve insulin sensitivity, and you will get these vitamin, chromium, inositol, folic acid in Ova Care. This is the tablet. You should consume one tablet twice a day. So you have to address your lifestyle, you have to change your dietary habits. So in order to improve your insulin, you have to quit eating refined sugar, refined carbohydrates. Then there is also a role of adrenal gland. So you have to combat stress. So what will combat stress? Good quality sleep of at least 7 to 8 hours of good quality sleep will address your adrenal issues. So this should be your primary treatment. Lose weight, eat healthy. So you want to avoid refined foods, refined carbs. Then you have to combat stress. This is very important. So by following these, you can easily manage polycystic ovarian syndrome. And if you follow this, you do not have to take separate drugs for inducing ovulation like clomiphene, letrozole, uh, dexamethasone. Then for addressing hirsutism, you do not have to take again other drugs. So in conventional treatment, for each symptom you have to take a number of drugs. But if you focus on this insulin, if you address this, you will certainly be able to solve all your symptoms of polycystic ovarian syndrome. And if you add these supplement, N-acetylcysteine, vitamin D, chromium, inositol, folic acid, then you will see marked improvement in your symptoms. Thank you.